Hi, Taskin. Tell me about yourself.
Good morning, ma'am. I am Taskina from the Maharashtra. I have completed B Pharmacy from the Rajaram Bapu College of Pharmacy, Kasaragod.
Yeah. What is GERD? GERD, GERD.
It is the gastroesophageal reflux disease.
Difference between the guidelines of adverse effect and poisoning.
In adverse effect, primary code is the manifestation code followed by the drug code, and in poisoning code, primary code should be drug code followed by the manifestation code.
Guidelines for a pregnancy.
Every condition can be coded. It includes C-section, failure of the vaginal delivery, number of fetus, outcome of the delivery, complication and gestational weeks, number of fetus.
Explain guidelines for external causes.
Reason for injury, place of occurrence, activity code, status code, action is the main term, and always code 7 digit.
Explain guidelines for HIV.
Assign code for only confirmed cases of HIV infection. If a patient admitted for HIV-related condition, then the primary code should be HIV code. In the sequencing order, the sequencing order is based on the severity of the condition. If a HIV patient is admitted for the unrelated condition, for example, traumatic injuries, pregnancy, puerperium period, then the primary code should be unrelated condition followed by the HIV code. Assign the asymptomatic code HIV code for the HIV positive, non-HIV and HIV test positive.
What is amniocentesis?
Amniocentesis is the surgically puncture to the amniotic sac to remove the amniotic fluid.
What is COPD?
Chronic obstructive pulmonary disease.
HIPAA full form.
Health Insurance Portability and Accountability Act.
What is a modifier?
Modifier is a 2-digit code at the end of the CPT code. It provides the information about the procedure. It having 3 types: CPT modifier, facility modifier, and HICPICS modifier. It also known as the SCPCS.
What is angina pectoris?
Angina pectoris is the chest pain. It is due to the insufficient blood supply to the heart.
Thrombus means?
Thrombus is the blood clot found in the cardiovascular system.
Which is receiving and discharging chambers of heart.
Receiving chamber is the atrium and discharging chamber is the ventricles.
What is the Roman number of olfactory nerve?
1, it gives the sensation for the smell.
Explain blood pressure.
Blood pressure is the systolic pressure followed by the diastolic pressure. Systole is the period of contraction and diastole is the period of relaxation. Normal BP range is the 120 by the 80 millimeter of the mercury.
What is cholelithiasis?
It is the presence of the gallstone or calculus in the gallbladder.
What are the regions of small intestine?
Jejunum, ileum, and duodenum.
What is neoplasm and its types?
Any abnormal growth of the cells, it having 2 types, benign and malignant. Benign is it does not spread to the surrounding tissue, and malignant is the spread to the surrounding tissue.
What is fracture and its major types?
Fracture is the breaking of the bone or cartilage. It having 2 types. First is the pathological fracture. It occurs due to the any disease condition, for example, osteoporosis. And second is the traumatic fracture. It occurs due to the trauma or accident. It having 2 types: open fracture and closed fracture.
What is the neuron and its parts?
Neurons are electrically excitable cells that transmit the signals to the body. It having 3 parts: cell body, dendrites, and axon.
Dysphagia means?
Difficulty in swallowing.
What is puerperium period?
It is the 6 weeks immediately after the childbirth.
What is CKD?
Chronic kidney disease.
What is PEXI?
Surgically fixation.
What is supine?
Supine is the lying the face upward, the palm of the hand facing toward the anterior or superior.
Can you explain two distinct parts of skeletal system?
What mean?
Two different parts of skeletal system.
Skeletal system having two parts. First is the axial skeleton. Second is the appendicular skeleton. Axial skeleton consists of from the head to navel region. It also known as the trunk of the body. It consists of the 80 bones. It also it contains the bones of the skull, vertebral column, and thoracic cavity. Second, appendicular skeletal system. It having 126 bones, consist of bones
Okay,
that
ma'am.
are
Can you
appendages or
explain functions of heart?
functions of heart. Thus, superior and inferior vena cava carries the deoxygenated blood to the right atrium. From the blood passes from the right atrium to the right ventricle through the tricuspid wall. After blood pumped from the right ventricle to the pulmonary artery through the pulmonary semilunar wall. Uh, then, uh, then blood passes from the pulmonary artery to the lungs for the oxygenated the blood. The oxygenated blood passes. The oxygenated blood carries the oxygenated blood carries the pulmonary vein to the left atrium. The blood passes from the left atrium to the left ventricle through the mitral wall or bicuspid wall. The blood pumped from the left ventricle to the aorta through the aortic semilunar wall. Aorta has three main branches: brachiocephalic artery, subclavian artery, and common carotid artery. Then, blood passes to the arterial system to the rest of the body, and this cycle is repeated or continuous.
Okay, Rasina, thank you.